Health correspondent Nicola Hill, who joins us from London. Nicola, good to see you. This is an important distinction, effectiveness versus efficacy, that many people, including myself, might find a confusing. Can you explain this difference further for us?
Yeah, it's really confusing, isn't it? And I think most of us tend to use both words for each other, but they're not synonymous. I was speaking to Dr. Simon Clark, who's a microbiologist from Reading University, and he puts it really simply. He says basically, if you have a vaccine that apparently has efficacy of 95%, and that means that that's the results were done in a trial. That's when they've actually had the scientists, you've had two groups of people, you've had your placebo group, and you've had a group who've been vaccinated. So that's the efficacy. The effectiveness is how it actually is working in the real world. So if you have this group of people given, say, the Pfizer-BioNTech one, which has a 95% efficacy, it means that somebody who is vaccinated is 95% less likely to become infected than somebody who isn't vaccinated. And I think if we just remember it as simply as Dr. Clark has said, that's great. And of course, the thing is, you have to remember with all these different vaccines, all these different percentages that have been quoted to us, which has completely confused us, as you say, you have to bear in mind that these different vaccines were tested in different circumstances. And that's because even if you have as big a trial as the Pfizer one with 43,000 people, they couldn't possibly have every single possible determination of the global population in that trial. And that's why we then have to look and see how effective is it in what we call the real world, when you've got people, different ethnicities, ages, weights, different underlying health conditions, and living in different countries. So if you think of that Pfizer one or the Moderna vaccine, Moderna, for example, their trial was held predominantly in America. Both of those were first off the starting blocks, so that was at the beginning of the pandemic. The later vaccines, let's look at the Johnson & Johnson one, for example, was one of the latest ones to have its trial. It was done predominantly in South Africa and Brazil. By that time, you had these new variants had emerged. So it did mean, and it was the peak of the pandemic, so it did mean it was a different situation that it had been for the Pfizer-Moderna one, and that's why you've got these different efficacies. But as far as the effectiveness is concerned, all of them are actually stopping severe COVID-19, hospitalisation and death, and that's really what's important.
So these two words, not synonymous. So in the end, does it matter which vaccine you receive?
What every single scientist and doctor will say is take the vaccine that's offered to you. Simply, they say every single shot in the arm is nearer to reducing and ending this pandemic. And you don't really have to worry about which one. I mean, I did say to Dr. Clark, is there any way of actually comparing the effectiveness of these vaccines in the real world? And he said, well, not really, no, because you've got different countries are using different vaccines, they're giving them to different people. You've got, as I said before, that list of different ethnicities, ages, weight, genders, and underlying health conditions. I mean, for example, here in the UK, it's great that our numbers are going down. I think the figures in the last 24 hours were still 4 people reported to have died from COVID-19, much lower than we'd had, for example, in January. I said, is that because of the effectiveness of AstraZeneca, which is one of the predominant vaccines here, and the Pfizer vaccines? And he said, you don't know. You can't definitely say that because we've had a major lockdown here in the UK, which will have had an impact as well. So the main thing basically is for all of us to take the vaccine when we're offered it, but we do still have to follow all the hand washing, the social distancing at the moment until they determine that that's not necessary. But for the moment, yes, the message is if you're offered any vaccine whatsoever, take it.
On that note, Nicola Hill, thank you very much indeed. We appreciate that clarification.